Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Mechanism of anti-TB drugs. The cell wall of the Mycobacterium tuberculosis consists of first layer is lipid bilayer, which also containing protein molecule, followed by peptidoglycan layer, and which is followed by arabinogalactane complex, this area, which is connected with mycolic acid and also having protein channels, porine. And these are, this green line is lipoarabinomannan. So the first drug is cycloserine. In the inside the bacterial cell, racemase enzyme converting L-alanine leave form alanine into dextroalanine D-alanine, and then ligase enzyme converting make bond between D-alanine bond formation, and then this is converting into peptidoglycan, and this fragment, this section is then transported exocytosis outside the lipid bilayer through enzymatic transport mechanism and forming this peptidoglycan layer. Cycloserine inhibiting both enzyme. So this peptidoglycan synthesis is stopped and cell wall synthesis is disturbed. This is the first drug. Second drug is this is ethambutol. Ethambutol blocking arabinosyle transferase enzyme. This arabinosyl transferase involved in biosynthesis of cell wall, and this racemase and ligase also indirectly involved in biosynthesis of cell wall. This ABT enzyme are expressed induced by the genes EMBA, EMBB, EMBC genes. The mutation in these EMBABC genes are responsible to the resistance of bacteria toward ethambutol. These enzymes, this is the glucose molecule internalizing through channel arabinose converting into arbino complex, and then arbino complex is transported outside to form this layer of arabinosyl galactane complex. Now this step is totally dependent upon arabinosyl transferase enzyme and ethambutol blocking this enzyme. Third drug is INH, isonicotinic acid. This isonicotinic acid is prodrug, and this drug is activated through CAT-G enzyme, which is known as catalase peroxidase hemoprotein. This catalase peroxidase hemoprotein is known as CAT-G. This activating the INH. Now the activated INH stopping INHA expressed nicotinamide adenosine diphosphate NADH specific enolyl acyl carrier protein reductase, which is known as enolyl acyl ACP protein. They are also known as fatty acid synthase. They are involved in fatty acid synthesis. So the activated I7IZ inhibiting these enzyme, which converting fatty acid into short chain fatty acid, which is known as mycalic acid. This process also due to fatty acid synthase 1 and 2 enzyme. And then these short chain mycalic acid are transported outside the cell and make bond with urbinogalactane complex, mycalic acid. So once INH block these enzyme, mycalic acid synthesis is blocked, and the mycalic acid content is reduced, and the acid fastness activity is reduced. The next drug is ethionamide. Ethionamide is also uh, mm, prodrug. It is activated inside, and the activated form inhibiting this KAT-G. So, mutation in the genes INHA and KAT-G, they are responsible for the resistance toward ethionamide as well as isoniazid. But the mutation in KAT-G is responsible for high level of resistance. Number fifth drug is rifampicin or rifampin. This rifampicin blocking the DDRP, the RPOB genes product of beta subunit. It bind with the DDRP DNA dependent RNA polymerase and block these enzymes which are responsible for the RNA synthesis, and this RNA synthesis is stopped and protein synthesis is blocked. So the mutation in genes RPOB responsible in toward the resistance of rifampicin. Number 6 drug is pyrazinamide. Pyrazinamide is also pro-drug. This pyrazinamide is activated toward pyrazoic acid through pyrinamidase. This pyrinamidase is responsible for this conversion into pyrazoic acid. This pyrazoic acid making the intracellular environment acidic, changing the pH toward acidity. Now this acidic environment is responsible for a lot of biochemical changes, including denaturing of protein iron enzyme. Now the denatured protein iron enzyme are cannot function normally. Its normal function is stopped due to its denature. Even this pyrazoic acid also responsible for ribosomal protein synthesis inhibition. Seventh drug is aminoglycoside, also acting through ribosomal protein inhibition. 8 para-aminosalicylic acid. This para-aminosalicylic acid, para-acetylsalicylic acid, this PAS is responsible to inhibit dihydrotereoate synthase. This was the old complete concept, but according to new concept, this PAS drug inhibiting thymidylate synthase and even the iron uptake of bacteria. So the mutation in genes THYA is responsible toward the resistance of PSA. Fluoroquinolones, which blocking topoisomerase 2 and topoisomerase 4, and which are responsible for DNA inhibition, and these are the anti-TB mechanism of the anti-TB drug mechanism.